Hello, how's everyone doing here? We're going to get started with back to the basics of chiropractic here. I just want to pull up my notes so you guys can get the best of the best on chiropractic. Cool. So, back to the basics. Chiropractic, well, let's start off like when did it come from? What's it about? Chiropractic was founded back in 1895 by a gentleman named Daniel David Palmer. We call him D.D. Palmer. And chiropractic's only been around for not very long. It's a young profession. We're still learning a lot. We're developing, advancing every day. But how it happened was D.D. Palmer actually did the first adjustment on a man named Harvey Lillard. And Harvey Lillard actually wasn't able to hear. So he had lost some of his hearing, and David did the adjustment on him, and his hearing was restored. And we'll just stop right there because let's stop on this note and go to the fact that the adjustment was not done because of back pain or neck pain, right? It was because some guy couldn't hear and restored his hearing. So we're going to dive in a little bit more on how the adjustment has a lot to do with more than just back pain, neck pain, and headaches, which is the majority of what I see, but there's a reason behind that. And we'll kind of dive into that just a little bit here. So what exactly do chiropractors do? What do we do? Well, first of all, we are the largest healing profession, natural healing profession in the world. Chiropractic actually is a Greek word for to do with your hands. So we like to do everything without drugs, without surgery. We're very in tune with our innate intelligence, and we want to bring that out in people when we're working with them. So that's the true idea behind chiropractic. We're not just back pain doctors, like I said. We work with the nervous system. Roughly, we have 90% of our nerves work with function on the inside of the body. 10% of the nerves actually transmit pain. And every second, there's 400 billion bits of information that your brain has to perceive from your body. So just think about that for a second. If you touch something, your brain has to perceive that, and it either sends a signal back to, maybe if it was like a hot stove, to take your hand off. If it was a signal from your heart, maybe because you're walking upstairs and it's like, hey, buddy, you got to pump a little faster because we need blood to be going through here, or your lungs need to dilate. So there's constant communication back and forth between the brain and the body, so you can function and actually live in the virtual reality world that your brain makes sense of based on all the senses and the proprioception and that communication that goes back and forth. Now it's our as our body has to constantly adapt to all the stimulation on the outside. So, and then our brain has to make the appropriate reactions. There's all sorts of different stressors that we have to constantly adapt to. We're very, very dynamic beings. Like I said, you take a step up a stair, your heartbeat goes up. You sit down, your heartbeat stops, or hopefully not stops, slows down. But we have to constantly adapt to this in order to survive. There's three main stressors that we have to adapt to in order to do this. The most obvious for all of us is a physical stressor. So this is like work, okay? If you have a job that there's a lot of repetition to, let's say you have to bend over, pick something up constantly all day, your body has to adapt to that. And when it doesn't, then we start to see things break down. So if it can't keep up with your doing this constant motion all the day, then it starts to send a signal, right? And the brain perceives that, something's not wrong. Something's not right. And something is wrong. And it'll send a pain signal, right? And that's how we know something's wrong. But that pain signal only comes after something's been going on for a while, right? So we have to understand that not always do we know that we can't always wait for pain, right? Because what's the best indicator of having a heart attack? I mean, yeah, we can kind of measure blood pressure and things like that, but when we have a heart attack, we have a heart attack, There's subclinical things going on behind that we don't always measure. Now, getting back on track here a little bit with the three kinds of stressors: the physical stress, and then there's chemical stress. And this chemical stress is from maybe food we eat, right? We don't always eat the best diet. There's a lot of genetic modified things. We don't need to get into that debate today. Just chemicals in our food, chemicals in the air. And so what we ingest affects how our body has to adapt to that. If we eat too much and we don't exercise, our body adapts by gaining weight. If we go to the gym and exercise and lift weights consistently, we get big biceps, right? And so that's how we adapt in that aspect with food. Now, the last one is emotional stress and thoughts. We call it thoughts and trauma, toxic thoughts, excuse me. So, and that's just emotional stress. I mean, we are in the most stressed out world that we've ever been in. Life is very fast paced. There's a lot of expectations from all of us, more so than I really think we can all manage. And, and so when we internalize all this stress, we're not adapting properly. We're not adapting appropriately. And then our body starts to break down from that kind of stress. I'll go into a little bit more detail about how that works too. I'm just going to check and make sure if we have questions at all. Hi, Dale. Nothing yet. And so, where are we at? Okay. And so let's kind of go into how this stress affects the body, affects the spine. Your body is kind of like a circuit breaker, okay? So your brain is like the power, and at every single level, there's nerves that come out that go to different parts of the body, okay? And it's just like your house. Like one part of your house, there's a circuit breaker that will go to the kitchen, that turns the lights on, one goes to the den, one goes to the living room, and then we all have that one that like goes to a couple different things, and we don't know why the computer turns off when that one does, but it does, right? The body works the same way. And let's picture you're at Thanksgiving and you've got a bunch of crock pots plugged in. You put some toast down in the toaster, and then you turn the blender on and boom, the lights go down, right? Everything blew a fuse. That's too much stress for that breaker to handle, and it blows the fuse. And then one of you has to go down in that deep, dungy, dark basement and flip that breaker on. Well, that's what chiropractors do. We look at the body, find different areas where there's that stress that's built up that can't handle it, and it's kind of like a fuse blown. And it's also called like an altered nerve pattern. Your nerves are just like a little bit confused, not functioning well there. We're going to go down in that deep, dark, dungy basement, find those, and when we do the adjustment, that flips the fuse back on and gets things functioning better and running properly again. It stimulates the nervous system to wake up. And the most important thing that happens is it sets your body into what's called a parasympathetic tone. A parasympathetic tone counterbalances all those different kinds of stresses, especially the emotional stress, physical stress, chemical stress too. But when your body is in a parasympathetic tone, what it's able to do is heal. It can heal, and that's what we need. We need to know that when we go to bed at night, your body, the growth hormone comes out, and you're able to start healing and wake up refreshed. Generally we are self-regulating individuals, self-regulating, self-healing, and so when we go to bed at night, our body's supposed to do that. It's supposed to be able to regulate those things. But if it can't adapt to all those stresses we're talking about, it starts to break down, we blow fuses, and then you have to come to the chiropractor to get adjusted and to help those things be able to adapt again, get the nerves functioning. Good. Questions? Flipping back in horror. Will you be showing at some point what you actually do to a new patient? Bring in the secretary. Okay, we'll see. I don't know. They're in lunch break right now, so I don't know if I have a live patient yet. But if they're watching, maybe one of them can come in. We'll see. Good question, though. Okay, we got all that. So, I mean, this would actually be a good place. So, what exactly does an adjustment do? Well, let's say that you're out shoveling, right? You can't adapt to that quick enough because it's a weekend warrior thing. Your muscles aren't used to it, and your body just breaks down, and your back breaks down because you're not used to shoveling. You didn't do it. Like you didn't train to shovel. So you come in because your back's out, right? We come in, we evaluate, we find the areas where it's stressed. And again, the most important part about the adjustment is that it sets it in that parasympathetic tone, calms the nerves down, calms the nervous system down, and gets your body healing. Your body craves balance. So when things are like tight and out of place and you're feeling crappy, it doesn't like that either, because you're being extremely inefficient. And on days when you have and you feel like that, I bet you also feel tired for that reason, because you're not being efficient. So anyways, we have you come in, we do some range of motion to evaluate how things are moving. We do a fancy scan in here. It's called an insight scanner that actually can measure some of the imbalances in the neurology and where fuses might be blown in the body. And then we also do x-rays, so I can see what's going on structurally, see where there's areas that weren't adapting or starting to break down. And then once I have a chance to go over all that, then we have you come back and we lay you on a table. I think you can see over here. Yeah, right there. That's the main adjusting table that I use. I told someone to go to a chiro. She was scared to call. Well, they can always stop in too. If you don't want to talk, you can call. Send her the video though too. Okay. Yeah, so anyways, we have the new patients. We'll have you lay face down on there when we do an adjustment, and we feel through, yeah, I'll answer that question in just a little bit. Then we feel through the spine, and I'm a very hands-on adjuster, so, you know, like I said, chiropractic means hands-on. We put a little pressure on the area that's jammed up, not functioning, fuse blown, however we really want to describe it, and it's a little push, okay? Sometimes you hear pops and clicks, sometimes you don't. There's lots of different techniques that we use in here. I do some real soft tissue techniques if, for like an elderly patient or for some babies. We've been doing some craniosacral work lately. I also have an instrument called an activator, and that I use on some extremities, like your limbs, your knees, things like that, and also on infants or people that are really arthritic. So no, I don't go in and just everyone's head. First, we do the evaluation. First, we just do our due diligence. We do a lot of testing in here to make sure that everything that you do is appropriately in the best care for you. Do you ever offer the teeter? Well, we don't do a teeter in-house, but inversion tables and teeter tables, yes, we absolutely do recommend those. Those are those tables that you get on and they tip a little bit. We recommend like at a 45-degree angle. It's a really good way to decompress the back, take some pressure off, especially people that have been standing all day. That's really good for a low back. You want more questions or details, just call and let us know on that. I'm going to get back to my notes here just a second to make sure we're getting everything. Yeah, so I had a couple questions about babies. Like, why would we see a baby in the office? It can't be stressful. Like, how does their back hurt? And this kind of goes back to focusing on the neurology. And sleep. Yes, Dale. Sleep is a big one. Sleeping and colicky kind of go hand in hand. It goes back to making sure that we get your body in a parasympathetic mode or tone or a healing mode, so the body can relax and you can naturally get back to your sleep rhythms. With a colicky baby, not all babies are stressful. Excuse me, not all babies are born naturally, which is fine. But birth can be a very traumatic, very stressful time for a baby, even in the best environment. I had 3 home births, but my first was really colicky. I had to do a lot of work with him. I'm still working with him, and that was, best case scenario, water birth, gentle, things like that. There's a lot of pressure that can be put on the baby's neck. So when they come in, if they're colicky, and there's a lot of tension in the neck from the delivery, maybe they were delivered with their head sideways, or maybe they were C-section and they had to get pulled out. Stressful on the baby, and babies can't, they just can't handle that. And so we kind of go through and we check, and those areas with a lot of tension and stress, we do really, really gentle adjustments. You wouldn't even the most common comparison that we use is you think about a tomato skin, and we wouldn't even the pressure would not even break through the skin of the tomato when you're working on an infant. But once we get that, those areas that are like super tensioned or crooked or whatnot from the delivery, we notice that the baby starts to calm down, and they're not in that state of that sympathetic state of fight or flight. And so when they're not in that survival mode because there's so much tension and stress going on in their nervous system, then they can calm down. Then the colicky stuff slows down. A lot of these colicky babies don't, maybe they spit up, maybe they're not pooping, things like that. Those are all stressful things that get shut down in the body when you're in a fight or flight or survival mode. So when we adjust and we relax those things, babies start pooping better. They sleep better for lots of different people, not just babies. We've seen in here too with anxiety levels. Anxiety levels come down in people after chiropractic care just because that nervous system is not so tensioned. It's not so focused on keeping your body structurally upright. It's not fighting the imbalances. Everybody can kind of take a breath and breathe and back to the basics there. Let's see. Let me check my notes again, make sure if there's anything. Any other questions that we have that we get a lot in here? What do I all see in my office? That was another one we had questions on. Go ahead. You're funny. Okay, so well, like I said, we see babies. We see, we're in a rural area, so we're open to everyone. We don't. We're good at everyone that we see, but we're not saying no to anyone. Like I said, we see babies. I'm working on patient like slips and falls. Slips and falls aren't just located or aren't just low back pain. I'm working with a patient that has carpal tunnel right now. So we're working on a wrist. If it's got a joint, if it's got muscles, if it moves, we can certainly work on it and relax everything. Actually, carpal tunnel is a really big common one that we threw here. You've got 8 carpal bones in the wrist, and like little nerves have to fit through there. If they tighten up from, let's say you have a repetitive job where you grip, or maybe you use a mouse all the time, and those tighten up and through there, we go in, we can do some adjustments, get those carpal bones moving again. It takes pressure off the nerve, and we feel better again. I have some pregnant moms that I work with right now. Getting adjusted when you're pregnant helps align the pelvis and make sure that the mom is creating the best birth environment for the baby as a baby is delivered. Lots of different health benefits to seeing chiropractor when you're pregnant, for sure. We're in rural Wisconsin. See a lot of farmers looking over their necks. We get a lot of neck pain and tension and headaches for that reason. A lot of neck pain correlates down into shoulder issues too. So I see a lot of people with impingement syndrome that have a hard time raising their arms just because of years of poor posture, of reaching. And, we work on posture and keeping shoulders back. Sinuses. We also work on sinuses. You've got openings in your sinuses and through here that doing some pressure work on there, massaging, doing some adjustments help drain sinuses. So we've worked on that with people as well. So it's a wide gamut of things that we do in here. It's not just neck pain, low back pain, and headaches. Although those are the most common and we're really good at them. We also enjoy seeing some of the other things. Anyone have any other questions? I'm kind of scrolling down here. Is that a one-way mirror? No, it's not. All right. Anyone have questions? No. Nothing? Okay. Let me make sure I got everything in here. First adjustment. We still have our special going on too. So in the month of January for new patients, we're doing complimentary exam, x-rays, and scans for new patients. And then for existing patients, if you haven't been scanned yet, we will do that complimentary too. And that's the way you can see how healthy your nervous system is functioning. It shows neurological imbalance, it shows neuromuscular tension, and it shows how much you are in your fight or flight response as well. Is it true chiropractors can do no harm? Well, we try not to. Our job is to actually make people feel better. So the point would be to focus on that. All right. Any other questions? I'll volunteer for a show. Well, Jill, if you were here, I'd totally do it right now. I think the girls are on lunch, so they're being camera shy here. But okay, if you guys have questions, you can post on here. I can always respond on this thread as well. Otherwise, you feel free to message our inbox at the clinic or call us if you have any questions, okay? And we will be back next month. We're going to do this monthly thing and over the lunch hour. I can't remember what the topic is right now, but there'll definitely be a post on Facebook about what it's about. If you guys have any hot topics that you want me to talk about, let me know, and we'll bring them up on here, and we'll do a lunch and learn just like this, and you can ask lots of questions then. Okay, all right, you guys have a great day. We'll see ya.